Hi, I'm Dr. Rachel Miro, and I'm a dentist here at Dental Implant and Aesthetic Specialists. And today we're going to talk about extractions and bone grafts. Do you need a bone graft? Why do you need a bone graft? And all things involved. You might be wondering, what is a bone graft? A bone graft is basically after we remove a tooth, extra material that's added into the area where the tooth roots used to be. This material lays the foundation for whatever you might be having next, whether it be a denture, an implant, and all things involved. Here at Dental Implant and Aesthetic Specialists, one of the main reasons why we do bone grafts is because they really lay the foundation for the implants that our patients are getting in the future. You really need a solid foundation when you are placing an implant, and this bone graft really sets you up for success. Bone grafts are not just important for areas where we've removed teeth, but they're also important for areas where there might be atrophy or resorption. We want to make sure that whatever your next procedure is, there's enough bone in the area to support it. There's a lot of reasons why a patient might need a bone graft. It's not just tooth loss, but it's also due to trauma. Here's what I look for when I recommend a bone graft to a patient. The first thing really is, does the patient have enough bone without needing a bone graft? That's pretty rare, especially if the patient wants to get implants in the future. When you remove a tooth, you want to fill the area where the roots were. A lot of times patients also have bone loss because they have periodontal disease, and we want to make sure that we add that bone to give those teeth stability. The most common question I get when I talk to patients about bone grafts is, what is a bone graft made out of? What is this thing that you're putting into my jawbone? There's a lot of different materials that we use for bone grafts, and there's a lot of different options for our patients. The first type of bone that we have available to our patients is autografts. Autografts are when we take the patient's own bone and we use that to restore the area that we're trying to fix. The other type of graft that we have is allograft. Allograft is, in other words, cadaver bone. It's bone that has been tested, FDA approved, and we're able to use this bone in our patients in order to help restore the areas. Other types of grafts involve xenografts, which is animal bone. And then the last type of graft material that we have is synthetic. A lot of patients don't feel comfortable having graft material either from a cadaver or xenograft, so synthetic bone is what they choose to go with, and we're totally okay with that. There are benefits involved with all of these, and we present all of this to our patients. That being said, the patients can make an educated decision on what type of bone is best for them. Let's talk about what happens during the procedure of actually getting a bone graft. Usually what's done is there's a small incision made in the gum tissue wherever it is that that graft is needed. Then what we do is we go ahead, make sure the area is nice and clean, and we will actually add the bone with a little spoon and a little packer, making sure that the amount of bone that we need and want is present. After that, we will cover this bone with a little membrane. Sometimes the membrane needs to be attached with a little pin. Sometimes it's okay to just lay it flat over the bone. After that, we'll go ahead and close your gum tissue back together with a couple of little sutures, and you will be good to go. You might be wondering what happens after you get the bone graft. After you get the bone graft, there's usually a healing period, and this healing period can be anywhere from 3 months to 6 months. This time is really for that bone to get blood supply, for that bone to turn over, and make sure that that foundation is being laid for whatever future procedure you may be having. Most commonly, it's implants, but sometimes it's just building up your ridge for something like a denture. After the procedure, as long as they weren't sedated, patients can usually go home and go about their daily activities. A lot of times, patients ask, can I work after my bone graft? And the answer most of the time is absolutely. Here at Dental Implant and Aesthetic Specialists, we want to make sure that when you have a bone graft, it's successful. Therefore, we give our patients post-operative instructions. These instructions include things like minimizing heavy lifting or excessive exercise, making sure we stay away from spicy foods or hot foods while the area is healing. Maybe you don't want to bite down on the hardest things for the first couple days. We really want our patients to feel like if they take care of the area, they're going to be able to get this denture, they're going to be able to get this implant. Dental bone grafts really help us set up our patients for success. They really help the longevity of the procedures. They really make sure that what we're doing, implants, dentures, are going to be successful. Therefore, if recommended, highly advised to get a bone graft, patients should definitely choose that option. If you're in need of an implant or a bone graft, periodontal disease, something that you're concerned about, give us a call. We are happy to help. I'm Dr. Mitchel Miro here at Dental Implant and Aesthetic Specialists, and I'm here to help you. Watch your mouth.